Awesome. Chase, thanks so much for sitting down with us today. Super excited to talk about kind of what it feels like to make a really big strategic pivot. But before we get there, I want to start by letting you introduce kind of Watsi to folks in the audience who don't know. So start with like what is it and how'd you guys get to the original crowdfunding vision?
Yeah, great to be here. Thank you all for coming. My name's Chase, and I'm one of the co-founders of a health technology startup called Watsi. We build software to help finance healthcare for people around the world. And we got started about 5 years ago. I was a Peace Corps volunteer, and I was riding in a bus in Central America, and a woman got on the bus and started asking all of the local passengers for donations to pay for her son's healthcare. And I remember thinking it was just a really simple idea. Why isn't there a website for this? And so got a group of friends together. Nights and weekends, we built a website where patients could post their photos and stories, raise money for surgery. We had low goals. We wanted to fund healthcare for 10 patients in the first 6 months. And the first day we launched, we got really lucky. 16,000 people came to the website. And in the first year, we grew so quickly, we actually couldn't keep patients on the site. So most of the time, donors went to the site. There was no one to donate to because the surgeries were being funded so quickly.
Yeah. And I know you guys have kind of interesting model for that crowdfunding service basically that the donations, they're all for the patients. Like, tell us a little more about like that mechanism.
Yeah, so there were 3 things that were really important to us with the crowdfunding platform. So it's kind of like GoFundMe or Kickstarter. You see photos and stories of patients directly fund their care. The first was that 100% of donations directly fund patient care. And you decide if you want to give us an optional tip to cover operating expenses. The second was that the money goes directly to the hospitals for the sole purpose of funding that patient's care. And the third was that we're going to try to be radically transparent. So we have a spreadsheet, which is just like a dump of our database where you can see and track every single dollar, where it goes, who's it's for, how much you spend on overhead, et cetera.
Yeah, and the transparency thing, I mean, that's kind of the standard in the startup world, but maybe not so much in the nonprofit world. How'd you guys get to that?
I think we just thought about what would we want organizations we support to do. And if we're donating, I would want to know how my money is spent. And so we just decided to try to offer that to donors. And the most direct way to do that was just to dump our database onto a Google document and let people dig through the data themselves and come to their own conclusions about the impact we were having. Awesome.
So earlier you mentioned how fantastic the kind of launch was around the crowdfunding product, and so I'd love if you talk a little bit more detail about like what was it actually launching, and then because we're talking about this pivot, how did you guys go from there to maybe just before you guys decided this new strategic direction?
Yeah, so we had this group of friends and we had built this website. We hadn't raised any money. It was completely self-funded. And we had about 500 people that had signed up on this waiting list to be announced of the launch. And I'll never forget, it was like 9 a.m. in the morning, August 23rd, 2012. I remember the date exactly. And we just pressed go, and we launched the website. And then it was just crickets. I remember like my mom donated, my aunt donated, my co-founder's parents donated, and then that was it. And we're like, oh shoot, how do you grow this thing? And we got very lucky, and a link to our website was posted on Hacker News, which is kind of like Reddit. It's a news website for technology, and that's what sent so much traffic. And from there, it kind of snowballed. We ended up changing our model a few years later. So what ended up happening was originally we thought of Watsi as a fundraising organization. We would help patients raise money for surgery. We measured success in dollars and cents. And the first 2 things we tried to do that worked really, really well. The first was just doing nothing, just organic revenue, so people telling their friends and family to donate on our website. That's always been a really consistent, good chunk of revenue for us. The second thing we built, which was by far our best product or feature ever, was recurring donations. So really straightforward, automatically donate every month. After a couple years, it's now 50% of our revenue, just automatically charged every month. But then after that, the issue is those 2 channels grew slowly, and they grew linearly, and we really wanted to find something that grew exponentially. And so we spent the good part of a few years trying everything you can imagine: corporate partnerships, matching, referrals, Facebook ads, gift cards, donate your birthday, you name it, we tried it. And the issue with all of those was that initially they seemed like they were working really well. Like a Facebook ad, you'd spend $1, raise $10, amazing ROI. But then as soon as you got into a wider audience, you'd spend $1 and only raise a few dollars. And every one of those things we tried started off looking very promising and then quickly became very inefficient. And I'll wrap it up with this quick story. We would do these different campaigns for holidays, and it was Valentine's Day, and we have a small but just like incredible team. I think one of the best things about helping to start an org is that you get to build a team of the most amazing people in the world and spend 8 to 10 hours a day with them. And we have a brilliant team, mostly engineers, designers, and we were building a campaign for Valentine's Day. And we were building this like little gimmicky thing where Watsi donors could send anonymous notes to their friends and family. And it was like this roundabout way of marketing Watsi to try to raise more money for patients. And we were like debating over like the color pink in the background or something of this app, and I was just like, this is so stupid. Like, why are we doing this? And really what had happened is we were just out of ideas. Like, we just wanted to fund surgery for more patients. That's what we existed to do, but we were out of good ideas. And I think that for me was a big learning point, that I was too far behind. I should have realized this point was coming months before and had something else lined up. But that was the point where we realized we had to fundamentally change what we were doing as an organization.
And not just a change that was, maybe addressing in a new country, like this expansion idea, not a change about kind of like scope. Maybe, we do, crowdfunding for more types of services, like a total change. So talk to us about like the new thing and how you guys got there. Like, where did it come from?
So the big change in our thinking was we originally thought of Watsi as a fundraising organization, and we changed to thinking ourselves as a fund allocation organization. And so what I mean by that is internally we said, we're mostly engineers, designers on our team. We set a goal, and we said, let's spend the next 6 months not pay attention to fundraising at all. Who cares about fundraising? Like, let be what will be. And all we're going to focus on is trying to automate everything to the point that we can run our entire platform with 2 people. So piece by piece, our work on the back end actually resembles a health insurance system. You have to price care, negotiate care, measure quality, assess for fraud, transfer reimbursements to hospitals. And piece by piece, we automated every single aspect of that administration. Funds are automatically transferred, all the accounting is automated, all of the anomaly detection for fraud is automated. We actually got to the point in less than 6 months where we're able to run the whole platform with 1 person. We're at 60, 70% sustainability. Our leverage is nearly 10x, so for every dollar we spend, we raise about 10x for patients. We're having bigger impact than I ever thought that we could have as an org. So we're funding about 200 surgeries a month, just really consistently with that 1 person running the show.
Yeah, applause worthy for sure.
Thanks.
It's incredible. So with that description, I mean, you're talking about taking what sounds like could be a staff of dozens, and doing it just a few people because you guys have so much technology. So I mean, in that phrase like tech nonprofit, you guys are extremely tech. Can you talk maybe about like, is that in the roots of the company, or did that just feel necessary based on kind of what your goals were?
It's the core of what we do. I think we're really a technology organization. People look at us as a healthcare org, but we're tech. Our first platform was a platform that helped patients raise money for surgery. Our new product, which I'll talk about in a minute, is a platform for administering national health insurance systems, but we're tech at our core. And I think part of that was just in our DNA from the start, and part of that was solidified. We got very lucky, and we were the first nonprofit to go through Y-combinator, which is an accelerator like Fast Forward, but more historically focused on for-profits.
And YC also gave you guys funding for the coverage project, right?
Yeah. So we call our first product Watsi Crowdfunding. It's the platform for helping patients raise money for surgery. Our new product is called Watsi Coverage. It's a platform for administering health insurance systems in low-income countries. So health insurance systems have a lot of administrative challenges. How do you enroll 10 million people into a national health insurance system? How do you identify those people when they go visit the hospital or clinic? How do you submit claims? How do you process claims? How do you reimburse providers? And we've basically automated that from end to end. So end to end, relatively mostly automated administration. And the idea is if we can just help countries save money, they can provide health coverage to more people and achieve universal health coverage. Y-combinator, I was at a hospital in Uganda that we worked with on the crowdfunding side, and the idea came, we were talking to the administrator there, and he said, I wish the local health insurance systems were as efficient as Watsi. The money just automatically shows up in our bank account. It's there, a day after we perform the surgery. Everything's automated, streamlined. But these health insurance systems, everything's pen and paper.
Yep.
And we went, and Sam Altman invited us to a dinner about YC research. We were having dinner, and I was just really excited about this idea that maybe we could help administer these health insurance systems more efficiently. And he said, here's a check. Go see if you can do it. And so we actually moved to Uganda, and an hour away from that hospital, there were a group of nuns, about 15 nuns that were running a rural health insurance system, or wanted to start a rural health insurance system. We wanted to build the tech to administer it. They invited us to live with them in their convent. So we have this team of 7 engineers, designers from San Francisco. We have a very diverse team, and the nuns were so kind to just open their doors to us, and we lived in their convent with them, and we sat next to them every single day and just built this platform from the ground up. We went in with no preconceived notions. We didn't know if it'd be a web app or a mobile app. We didn't know which pieces of insurance we would help administer, but we just did 100 iterations, literally sitting next to these nuns, and in 3 months got a platform up and running. And we've done about 15,000 patient visits already in Uganda. We just signed a 6-figure deal with the government to help run their national health insurance system. And we're actually negotiating a 7-figure deal, which isn't signed yet, to actually implement to cover the first couple 100,000 people in this country. So it's come a long way.
Yeah, wow.
The first year.
Yeah, and that's in less than a year.
Yeah, so it's in less than a year, yeah. So we had the 6-figure revenue about 9 months after launching the platform, a little bit less. The 7-figure deal is not signed yet, but we're in legal. But we joke that it's black diamond business development. It's like the hardest business development in the world. Like most startups would never work with government, ever. It's like big, slow, bureaucratic. They would never work in health insurance. It's really complicated, tons of conflicting interests. They would never work in low-income countries. There's limited power, limited internet, limited technical literacy. There's no money to be made. And we're doing all 3 of those. We're doing governments and low-income countries to help them administer their health insurance systems. It's like the most insane thing of all time. But it's really, really fun. No one else is trying to do this. There's no one else in the world that is crazy enough to try this. And if we succeed, the impact is huge.
Exactly.
If one country uses this to cover 10 million patients for the next 10 years, I mean, it's bigger impact than I could have ever imagined when we were first starting Watsi.
Exactly. So you said it, but I want to spend a little more time on it. Kind of all of these challenges that come with those things that you just listed. There's got to be some crazy stories about how you guys worked with these governments. I'm sure about just even the technology, even probably like just network connectivity would be like enough of an issue for like a remote development team, and then try to build this thing in concert with folks on the ground.
Yeah, there's a lot of challenges. I would say the biggest 2 are the business development, which I just talked a little bit about, and we're just learning as we go. We're fortunate to have the opportunity to hire some people that have a lot of experience with this, a lot more than me. We were lucky to get that first deal signed, which was for planning. So it was for basically speccing out what a country would need to run their national health insurance system. And this next deal we're negotiating right now is to actually implement the software to run it, which I really hope we get. I would say the other big challenge is on the product side, and I think that's what we get up in the morning and love doing. But it really is about, how do you run the system when the internet goes out? How do you verify patient identity when there's no internet? So, a patient goes to a clinic, how do they know they didn't fabricate their insurance card, that they're really enrolled? How do you aggregate data from 1,000 different hospitals and clinics into one central administrative office? And that stuff, I think, it's really a challenge for us around balancing agility and scalability. You want to build, these are enterprise scale systems. We have an amazing engineering team. And it's really about building things that are performant, that are scalable, that are secure, that are protecting patient privacy, but at the same time trying to build them in a way that they're flexible, they're user-friendly, they're agile. And that balance, I think, is something that no one will ever get perfect, but it's a constant tension that we think a lot about.
Yeah. And a couple touchstones for sure in this conversation have been 1, kind of efficiency, and 2, scale. So I would love for you to talk about how do you guys monitor that stuff? What are your metrics around efficiency or scale, and how do you know what the impact is above and beyond just kind of people?
Yeah, so scale. After Y-Combinator, we had some office space donated to us by a couple other startups, or for-profit startups. And one of them, I won't mention their name, but they had this computer that had these little bubbles. So every time like an order went through the website, it was a bubble. And the size of the bubble was the size of the order. So a $10 order, a $100 order. And 3 months after we moved in with them, they were having $1 million days. $1 million revenue. And the whole office would just crowd around this monitor. And there were these like huge, like $200,000 bubbles going up the screen. I'm like, $1 million, like this is a team of like 20, 24-year-olds built this website, and they're doing $1 million a day in revenue. Yeah. And I was like, why can't nonprofits think like this? Like, like they had been around for a year or two, a small team, $1 million a day in revenue. I'm like, nonprofits should be doing this. And so that's what really just got us the bug of scale, like wanting to build something that's really big. We're very metrics driven, but in the early stages of something in the discovery phase, we try to be more qualitatively focused and quantitatively focused. So we think about what questions do we want to answer. So this year we just had a board meeting, and the questions we want to answer are, the first one is, does our platform save health insurance systems money? So we partnered with Harvard Medical School. We're doing an evaluation this year in Uganda to actually quantify the cost savings of how much money our technology reduces in administrative expenses in the healthcare system. And then if you extrapolate, how many more people can get healthcare because of those savings. So it's a huge problem, but worldwide, up to 40% of money for healthcare is wasted. This is trillions of dollars every year that funds no healthcare that is lost to administrative inefficiencies. If you could reduce that by even a small percentage, you're talking about freeing up enough money to cover healthcare for millions, tens of millions, hundreds of millions of people. The other questions we want to answer are, is there demand for our product? So closing a couple deals with other healthcare systems. Can we make money? So really figuring out our revenue model. We're not in it to make a profit, but I do believe that we need a revenue model to really hit the scale that we want to achieve. And can we fundraise to kind of cover our costs before we reach sustainability?
Exactly.
Yeah.
Man, so I have so many questions, but I know the audience out there probably has some as well. So we'll let them get in after I get one more, and then if they don't have questions, then I'll fill in. But I have one question about the name, Watsi. So I've heard it's a town in Costa Rica.
Yeah.
It's not spelled Watsi though, right?
It's spelled, so there's a funny story. So when I was in the bus and I met that woman that was fundraising, the town was Watsi, and it's in the southeast part of Costa Rica. It's spelled U-A-T-S-I. Phonetically, some people spell it Watsi, but no one could spell it with a U, so we're like, we'll go with a W. But actually, I mean, to be fair, a lot of people, it's a Bribri-speaking territory, so it's kind of the equivalent of Navajo Nation in Costa Rica. So they have an autonomous government, a different language, and in Bribri, it's U-A-T-S-I, and in English or Spanish, people spell it W-A-T-S-I. But I was curious what the name meant, so I went and I talked to some elders in the community, and I was like, what does Watsi mean in Bribri? And no one really knew. Then this one older guy, Bahil, told me that he thought it was the name of a skunk. And I was like, this is a horrible name, but we decided to go with it. So
yeah, sounds good.
Yeah, sure.
I actually was poking around on the map, and I found there's a little town in the same area named Chase.
Yep.
Coincidence?
No, it wasn't named after me. It was yeah.
Anyone in the audience with questions? I hope there's mics out there. Yeah, let's go in the back here.
Thank you so much. Have you thought about this, or does it make sense to do an iteration of this in the States?
It's a great question. We've actually been approached by a couple systems that are like at a very high level kind of asking that same question. My gut reaction is I want us to stay really focused. I just want to focus on administering health insurance, and I just want to do it in low resource settings. And I think that's how we're going to have the most impact right now. I think in the US, maybe down the line, it's something we would explore. I think in the US, it's more of a political challenge right now than a technology challenge. It's not a challenge of how do we get money from A to B, how do we aggregate claims. It's really a challenge of incentives and political alignment. And I don't think we're the team to solve that problem. So until that's solved, I'm not sure we'll have a huge impact. I think the second kind of thing we're taking into account there is that the secret, I think, to our platform is that we're doing end-to-end administration. So the same platform that's used to sign someone up for health insurance is what the health insurance organization or government is using to reimburse the hospital. And historically, those have been fragmented into like 5 different apps that are all supposed to talk to each other. And you can really only implement an end-to-end solution if it's like a single top-down universal health insurance system where a government is implementing it. So France built software to run their national health insurance system like this. Estonia, Taiwan, we're doing the same thing for low-resource governments that can't build their own software. Where it might be useful in the US is for managed care organizations like Kaiser, where the health insurance company is the same as the provider network, and they can actually mandate that vertical integration. So maybe explore opportunities there in the future, but right now we're just really focused on low resource settings.
Any other questions? Hands? So while we're waiting, I want to follow up on that, actually. Healthcare in the United States is for-profit. It's a big business. And what you guys are, I mean, you're obviously a nonprofit. So how do you guys think about that in terms of, one, as you go to market, does that change the conversations? And two, were there ever times when you guys considered maybe doing a pivot, not just from, crowdfunding to coverage, but also from not-for-profit to profit?
Yeah, it's a good question. I don't think there's a perfect answer. So I'll talk about it in two parts. So the first is our thoughts around nonprofit versus for-profit. And the second is just how I think we can scale the most as a nonprofit. So the first, when we first launched the crowdfunding platform, we had no money. I quit my job. I had 3 months of savings in the bank. And I said, if I don't raise money in 3 months, I got to move in with my mom. So that was kind of the deadline I gave myself. Everyone turned us down. We were cold emailing foundations. No one was giving us money. We got very lucky to get into Y-Combinator. They were our first major funder. But we had one investor come to us and say, if you become for-profit, I'll give you 50 grand, and I'll help you raise your Series A. I just thought this was crazy. I mean, like, we're a crowdfunding platform helping patients that make a couple dollars a day raise money for surgery. Like, it just didn't feel like a for-profit. I didn't see how we'd ever produce venture-backable returns. But we thought a lot about it. We ended up turning them down, and I'm really, really happy we did that because we did a much. I think we would have been really limited if we had to try to produce kind of like returns that venture-backed companies are expected to produce. This time, this pivot, same thing happened. We had a couple funders come to us and say, we'll write you a much larger check than that first one if you spin out a for-profit. And again, we turned them down. And the reason for that is that we are primarily in the business of serving governments to run subsidized health insurance systems. And it didn't feel right to me to kind of extract profit out of that model. But that said, I don't think it's a binary thing. I don't think there's like a perfect right or wrong answer here. I think it's contextual, and I think strategically, if there's an opportunity to be a for-profit, it's probably a better model. There's just more infrastructure. It's just easier to scale. But also it matters around alignment, like what matters to the team and the funders and the users. As a nonprofit, we're sticking nonprofit. I think it's, for a bunch of reasons, the right model for us. But I believe a lot in revenue models, and I'm really jaded on the donation side now. It doesn't mean I don't think it's possible. I think it's totally possible to have a donation-based model, but it's really hard. We couldn't figure it out. And if you look at the top 10 largest nonprofits in the US by revenue, by assets, by income, they are all either healthcare education, and they all have a revenue model, either tuition or premiums. And I wouldn't be surprised if in 10, 20, 50 years, that list of the top 10 largest nonprofits, and not that size necessarily equals impact, but it's a relatively good proxy. I wouldn't be surprised if those are all technology or tech-enabled healthcare and education nonprofits. And I imagine they'll all have some sort of revenue model. And so we're really focused on getting to the point where maybe not 100% of our revenue is earned, but somewhere around, say 80, 90% is, just to create an engine so we can really grow. And just to give, last I'll wrap it up, I mean, that gap between the nonprofits that have a revenue model and the nonprofits that don't is enormous. The largest that run solely on donations are in like the $3 to $4 billion a year level. The ones that have revenue models are in the $60 to $100 billion a year level. So I mean, it's like a huge chasm to try and cross with just donations.
Yeah. So I know you just said you're kind of not that interested in donations, but I have to share one thing that I heard about this very morning, which is that you guys have a super clever, what we would call in the for-profit space, growth hack, and what we call, I guess, in the nonprofit space, it's just like really effective fundraising. An automated email you guys send for crowdfunding if there's a patient whose name matches the person's name.
Yeah.
So it's like, Patrick, we just wanted to let you know today, we just had a new patient come on named Patrick, and we just wanted to let you know.
It works. I mean, that's like, we were really getting creative. Like, we tried a lot of stuff to raise money, and that one works.
Yeah, unfortunately, no patients named Aston yet.
Well, hopefully you'll get an email and there's one on there.
Awesome. Well, if there aren't any other questions in the crowd, actually there is one. Let's go over here really quickly.
Thank you. Hi. You mentioned you tested so many different things, and I'm curious if you were systematic about testing all of those things, or I feel like it's easy to get lost in that process, and curious how you approach that.
Yeah, I mean, we tried to be as systematic as possible, and I think we actually, almost became maybe too systematic. We kind of went down this rabbit hole of like trying to quantify everything, right? So it's like you kind of try to A/B test all the things and have like it gets to the point where like sometimes common sense like is actually just better. So there were things where we'd have these huge debates around like, well, do we really have the data to say that this doesn't work yet? But like in people's guts, the whole team just knew it wasn't going to work. So we kind of had this motto internally that the data gets the vote and the humans get a vote. And you look at the data, you understand the data, but also the team has to believe that this feature or product has a future. So we were pretty systematic. We would basically like spend a month trying a particular growth hack or advertising channel. We would set goals around it, how much we're going to invest, how much we wanted to get out of it, and then we would just go for it. And someone would own that process. And at the end of the month, we'd come together, we'd review the data, we'd kind of have a meeting about it and decide if it seemed promising enough to continue or not. We probably did that with 15 or 20 things. And again, the really tricky thing in the nonprofit space is a lot of them worked. They just didn't work well. And what I mean by that is you could invest $1 in Facebook ads and raise $2, $3, but at the end of the day, you're spending 30, 40% of your money on advertising. And is that really the way that we were going to have the most impact as an organization? And my answer to that was no. There might be organizations that do think that's the way to have the most impact, but for us, we could just always find a way to invest $1, raise a few, never a way to invest $1 and raise 10. And the last thing I'd end with there is that we did a lot of research on charitable giving and how much is charitable giving increasing or decreasing in the US annually. And charitable giving has been a pretty consistent percentage of GDP for the last 40 years. Like in terms of a percentage of GDP, the amount that people are giving has not necessarily increased or decreased. And so what I took that to mean was that a lot of these organizations are just fighting for the same size pie every year. And I want that pie to go to the most impactful organizations, the organizations that are having the most impact, not the organizations that are spending the most money on fundraising. And yeah, at the end of the day, I just didn't want to wake up and become a Facebook ad organization. I wanted to use technology to help provide health coverage to everyone in the world. So that's what we pivoted to try and do.
Just a fantastic vision. You guys are executing amazingly well. Thank you so much for taking the time today to share all of this, and I learned a ton. I hope everybody else did too.
Thank you very much.
Yeah.